of the nightmares related to the Yamane technique are associated with technical difficulties in the maneuver for inserting the second haptic into the needle. This video aims to provide simple and important tips that can help achieve better results with this technique. First tip, be careful with the position of the infusion trocar when operating on the right eye. To free up the necessary space to correctly handle the second haptic, move the infusion trocar in the right eye inferiorly. Also, move the trocar on your left to a slightly more superior position, regardless of the eye's laterality. This way, you create space to properly handle the first haptic, which has the exit vector pointing upward in that quadrant. The superior trocar on the right side does not interfere much with the exit of the haptics, but be careful not to let it obstruct the movements of your corneal incision. Place it in the middle of the quadrant. Third tip, instead of positioning at 3 and 9 o'clock for the scleral tunnels of the haptic exits, shift the positions slightly counterclockwise. This way, you will have a better angle to perform the insertion of the second haptic into the needle. Another important tip, instead of making your corneal incision in a T configuration with the axis of the scleral tunnels, prefer to make it a bit more superior, forming an angle of approximately 70 degrees with the axis of the first haptic. This Y configuration facilitates the maneuver to insert the second haptic into the needle as well, preventing the haptic from bending or breaking during insertion. Insert the first haptic directly with the IOL injector, and then use forceps to reinforce the haptic insertion. For the insertion of the second haptic, do not hold it too close to the tip or too far away. Enter through the main incision or a paracentesis to perform this maneuver. Note how the correct choice of the locations of the scleral tunnels, corneal incision, and the position of the trocars allow for an easy execution of the most challenging step of this surgery, which is the insertion of the second haptic.